This is the recording for the occupational English test, and this test is held at Medcity International Academy, Kannur on 18th April 2023. The candidate name is Said Afra and the candidate number is 6200. The interlocutor is Sukumar Mesbabu and the interlocutor number is 7652. This is role play number 1 for the profession of nursing. Good afternoon.
Good afternoon, sir.
May I see your identification, please?
Well, it's here.
Oh, well, thank you, Afra. Okay, thank you so much.
Thank you, sir.
This is the test of your English language, not an assessment of your professional knowledge. So keep it in mind and speak as you would naturally.
Yes.
We'll move on to warm-up section to get you started. This is not in any way be assessed. So tell me the current trends in your nursing field.
Well, there are many trends changing nowadays. Our nursing profession is changing dramatically. So the initial days we were using this olden records such as paper records, so which are now updated into electronic records. So and our nursing profession is practicing nowadays evidence-based practice, which means there is a scientific rationale for each and every procedure. Moreover, I would really like to say that in present days, the nurse is functioning as a nurse practitioner in European countries, which is equivalent to a clinician and a physician.
That's good.
Yeah, these are the trends which are changing in the recent days.
Okay. So what qualities does a nurse should possess?
Well, there are plenty of qualities, and I would really like to say that first of all, the nurse should have a good communication skill in order to gain a good rapport and develop good communication with the patients in order to gather the clinical data.
Okay.
Apart from this, a nurse should be honest, competent, dedicated towards the profession. Well, these are some of the qualities that a nurse should possess.
All right. For the last question, why did you choose this OET?
Well, thank you for giving me this opportunity. OET is a platform where I can prove my English knowledge proficiency. It is my long-term ambition to work as a nurse in any of the European countries such as London and Ireland. So to prove my English knowledge proficiency, OET is one of the platform to get registered. Hence, this is the reason.
That's good, Afra. That's the end of your warm-up section questions.
Thank you, sir.
Now let's move on to the role play number 1.
All right.
So here I'll be taking the part of the patient and you will be taking the part of the professional role. That means nurse.
Yes.
So the role play will last for a total of 5 minutes and you will be given 3 minutes to prepare for the same. The role play intends to get evidence of your ability to perform effective communication with the patients. Do you have any questions?
No, sir.
Thank you. So you will have 3 minutes to prepare for the role play and you can make notes on the role play card if you wish to do so. So here is the pencil.
Thank you.
And this will be your role play card.
Thank you, sir.
You can look at the card during the test and you can write anything if you want to, but at the end you can return the paper to me. That's good. Your preparation time starts now.
Thank you, sir. How may I address you in this role play?
You can call me as Jack. Okay, Afra, that's the end of your preparation time. The role play will last for 5 minutes and don't worry if I stop you when the time is up. And you can begin now.
Good morning, Mr. Jack.
Good morning.
How you're feeling today?
Well, I am absolutely fine.
Mr. Jack, I'm the nurse on duty today. I'm here to guide you through the some of the pre-operative instructions. I hope, is it clear?
Yes, nurse.
Yes, I think you are here for hernia repair surgery, am I right?
Yes, nurse, I am
right.
here for that.
Well, Mr. Jack, how well you were able to follow the pre-operative instructions?
Taking my health into consideration, I'm following my instructions in a good way.
All right. I hope you have not taken any food for 6 hours and no fluids for past 2 hours. Am I right?
Yes, nurse.
Okay. All right, Mr. Jack. Before we proceed further, do you have any queries?
Well, nurse, like following these instructions which was given to me, like for the first time, not drinking this water and that food. My mouth is dry now and I feel to have a sip of water.
I can sense this, Mr. Jack. It is very common for everybody to feel this because you are nil by mouth. For the better understanding, Mr. Jack, I would really like to explain you that what is the need for you to stay nil by mouth. Shall I?
Yes, nurse.
Mr. Jack, it will induce vomiting and there is a risk of vomiting under anesthetics. So this is one of the reason we are advised you to stay nil by mouth. Am I clear?
Yes, nurse.
All right, Mr. Jack. Now proceeding ahead, I need to do some clinical observations. Are you okay with that?
Yes, nurse.
Well, Mr. Jack, do you have any previous illnesses?
Well, I'm a 50-year-old person. Nevertheless, I maintain my health in a good way. So far, I haven't had any kind of health issues. Absolutely, I'm fine, nurse. This is the first time, undergoing such kind of operations.
Thank you for answering my questions, Mr. Jack. Now I will be guiding you to the preclinical observations and preoperative instructions that you need to follow.
Okay.
Shall I?
Yes, nurse.
Firstly, I would really like to instruct that you need to change your dress to a hospital gown, followed by a compression stockings and a non-slip slippers. Am I clear?
Yes.
All right. Now, Mr. Jack, you have to take off the valuable jewelries and watches, okay, when you come for the procedure. Clear?
Well, nurse, let me tell you, this is my sentimental watch. So I cannot remove it from my hand. So far, I didn't remove it. And that too, I'm going to undergo this operation. So when I wake up, I'll see the time also.
I can sense your feeling and you are reluctant to wearing a watch on your daily basis. It's hard for you to keep your watch away. But it is I really like to stress that it is very important for you to take off the watch because there is a possible need for electric current to seal the blood vessels. And hence there is a risk of burns due to a metal injury. Due to this reason, I'm insisting you to take off your watch during the procedure.
Okay.
Am I clear?
Okay.
All right. I hope you have understood me.
Yes, nurse. When you're telling to me, I feel emotionally strong.
Okay, thank you. And for proceeding further ahead, the doctor will be coming here and he will be discussing the personal details and he will check for your medical details and he will be giving you all the necessary informations for the surgery. And I hope you have understood so far.
Yes.
Now presently I will be needing a consent for the procedure before we start the procedure. Clear?
Yes, nurse.
Yes. Before we proceed, what are the post-operative arrangements you have made, Mr. Jack?
Well, nurse, my sister, she is going to come to me before the operation and she will be taking care of me.
Okay, I appreciate and it sounds good that you have a support system.
Yes.
All right. Any other post-operative preparations you have done?
Well, other than this, I don't have any other things. Right now, I should call my sister. I should intimate her about the operation which is going to happen.
Well, Mr. Jack, I'm really sorry to say you that there is no proper and assured time for the discharge. There are certain criteria and factors of discharge requirements that you need to clear before you are discharged.
Okay.
See, first of all, your vitals need to be stable and you need to be able to tolerate the food and fluids. So these are the factors are very important before you proceed for discharge. And you have to pass the urine. Okay. So please, we have to note down and observe these discharge requirements and then you will be given the discharge.
Yes, nurse. Whatever you want to do, I'll be cooperating.
Okay, all right, Mr. Jack. Now we will require your consent to begin the clinical observation.
Okay, nurse.
I hope you will give me the consent for the observation.
Well, nurse, I'll be giving, but let my sister come so that she will also see and she will be signing it.
Okay, I will appreciate that and no problem. We can wait for your sister to come and we will get the consent for begin the clinical observation. Okay, I hope you have understood.
That's the end of your speaking test. Please return the role play card to me.
And here.
Thank you so much, Afra.
Thank you, sir.
Medcity International Academy. Trusted hands forever.